We acknowledge the traditional owners and custodians of the lands on which we meet today. On behalf of Group 4, we pay our respects to their elders, past, present, and emerging.
A vaccine is the world's best hope to conquer COVID-19 pandemic. This line graph illustrates the number of people vaccinated from January. The line rose steadily but started to flatten at the end of August. Fewer people are getting vaccinated and anti-vaxxers protest against vaccination worldwide.
We explore the extent and nature of vaccine hesitancy under three perspectives: global, structural, and individual level. There are many issues in each level, but in this video, we will only focus on three main factors: the global accessibility, national healthcare systems, and individuals' confidence in vaccine safety, efficacy, and necessity.
The SAGE conceptualizes amenable barriers to vaccine uptake as the 4 Cs. Our team is proposing 4 evidence-based actions for the World Health Organization to improve global vaccine uptake.
Access to vaccines accounts for vaccination hesitancy within 4/5 of the world's population. And here are some ways to counteract this, looking primarily within the African region. Firstly, we can ship back bulk vaccines to regions with the capacity to fill vaccines in vials. This can happen in countries such as Senegal and South Africa, which already produce few approved vaccinations for yellow fever. Next, we can encourage the development of vaccines in lower income countries through a series of incentives, which has been useful in the development in antibiotic treatment, such as milestone payments for smaller companies and tax incentives for larger ones. Lastly, we can increase access to Africa through clinical testing within the region. This has been shown to work within Israel. We managed to get first access to Pfizer vaccine by sharing data on herd immunity.
Everyone has vested interest in universally robust and resilient health systems, whether they are directly or indirectly affected by a pandemic. A jab in the arm is just the final step in a long journey that includes research, cold chain systems, and health promotion. To support global mobilization towards universal vaccination coverage, the WHO must enhance its capacity to guide governments towards sustainable, country-owned, data-guided, and people-centered healthcare responses. WHO should guide global, transnational, national, and subnational coordination through a social justice lens that empowers countries affected by conflict, disaster, and humanitarian crises. This involves establishing foundations for vaccine procurement planning, supply chain management, and an integrated healthcare vaccination service delivery system.
Indonesia's vaccine confidence has plummeted from 2015 to 2019 due to the Muslim leaders issuing a fatwa, a religious warning, as they believe vaccines are haram. In addition, countries such as Malaysia and South Korea reported vaccine reluctance due to a high misinformation of vaccines through the internet. This evidence illustrates an underlying issue, which is lack of education surrounding vaccines. Therefore, education programs that customize solutions to individuals or community circumstances can have a large influence in shifting the community's mindsets. For example, a study conducted in Pakistan found that having a discussion or announcement in the mosque immediately after prayers by religious leaders, or door-to-door visits for women in Pakistan, as they are not allowed to leave during the day, can increase the effectiveness of community-level mobilization staff in winning the trust of people. This can consequently result in a higher confidence of vaccines.
Here's a past example demonstrating the application of community education, the collaborative pilot program developed in rural Hainan Prefecture in China. In the program, information on HPV, such as its risks and management, are delivered in the education session. Moreover, on-site vaccination work are administered and scheduled around the school's calendar. After the initiation of the program, 99.5% of the children included complete the full three-shot hepatitis B vaccine series. With a diverse collection of partners such as the schools, healthcare professionals, and the provincial government, the knowledge base and reach of the HPV, the public recognition and trust of the program, as well as the vaccination coverage are increased and maximized. And this program demonstrates great success and is also applicable to the COVID cases.
Motivational interviewing as a way to reduce vaccine hesitancy has proven effective as a solution in the past. Its simple aim is to not attack the negative roots of vaccine hesitancy, but have positive motivations for behavioral change reveal themselves through active listening, rapport building, and empathy. This option isn't for everywhere, but the WHO should encourage as many countries to employ motivational interviewing as possible. Thank you for watching.